And I'd like to welcome everybody today. My name is Ruth Kaplis. I'm the National Content and Media Relations Manager here at JDRF. On behalf of everyone at JDRF, I'd like to welcome you to tonight's Let's Talk T1D educational series. We're excited to present you with more information on JDRF's mental health strategy. The presentation itself will be approximately 30 to 35 minutes long, and then we'll open up the session to your questions to our presenters. If you are not familiar with JDRF, we are a global leader working towards an end to type 1 diabetes through both research and also funding and advocacy. JDRF also supports people and families in the T1D community from the time of diagnosis by helping those living with T1D have better, healthier, and safer lives while we work diligently to find cures. The education series offers information on a new topic approximately every other month, although we will have one next month in June on staying healthy in the summer with T1D. We also host a virtual connection series on the fourth Wednesday of every month. This is an unstructured opportunity to connect with others with no formal programming. And to learn more and to sign up for the next connection series, which should be on May 24th, so next week at 12 p.m. Pacific time and 7 p.m. Eastern time, and then on June 28th at those same times. So just a couple of housekeeping notes. We are a big group tonight, so to minimize background noise, please just keep your microphone on mute. I just wanted to remind everyone again who just joined that we are recording this to post to our YouTube channel. So please turn your camera off if you don't want to be on video. And just remind, please mute yourself if you haven't already. There's a raise hand button. If you need any clarification during the presentation, you're welcome to raise your hand. We do encourage you to post your questions in the chat function, and we will comment on all of them at the end of the sessions, and we'll try to get to all of them, time permitted. And we will put a JDRF contact email address in the chat function. So if you have any comments or you'd like to send some feedback after the session, we're very excited and they're welcome. So I'd like to introduce our speakers tonight to talk about our mental health strategy. Please help me welcome Amanda Hillman, National Manager of Mental Health Programs, and Laura Green, PhD, National Manager of Research Programs and Communications, both at JDRF Canada. We'll leave with an overview of our mental health strategy to date and upcoming research projects in the pipeline. I just want to remind that while we're available to answer any questions, we are unable to answer any personal questions about any personal mental health concerns. We can put some information from our mental health resources section in the chat, but tonight we're just talking about the mental health strategy specifically. And so with that, I will turn it over to Amanda, and thank you.
Thanks so much, Ruth. Hi, everyone. My name is Amanda Hillman. I'm the National Manager of Mental Health at JDRF Canada, and I'm really excited to share with you some information about the work that we've done since we launched the mental health strategy in the past couple of years and sort of where we're going in 2023 and beyond. Already skipping ahead. All right, so we've known for a really long time that people who live with diabetes are at a greater risk of mental health disorders than those without diabetes. Type 1 diabetes is a condition that's 24/7. It has no breaks, it has no days off, and the burden of self-management can sometimes be overwhelming. Mental health and diabetes, oh, I'm hearing an echo. If someone could, thank you. So mental health and diabetes do have a complicated relationship. They affect one another. Poor mental health can lead to not caring about diabetes and poor self-management. And then on the other hand, the pressure of constantly managing diabetes can lead to anxiety and burnout. In fact, 1 in 5 youth with T1D experience anxiety. And then diabetes distress also exists, which is a clinical term describing the powerlessness, stress, guilt, worry, and denial that comes with living diabetes, as well as the burden of self-management. And almost half of adults with T1D experience diabetes distress, so it's very common. Yet with all of these increased risks, routine diabetes appointments rarely address mental health. And even if they do, healthcare providers often don't know where to refer their patients since there's no standard referral pathway. And then to further complicate matters, there are few mental health care providers that really understand the unique needs and mental health concerns of people who live with diabetes. And there's also a lack of funding for psychosocial research in diabetes. And then on top of that, the evidence that does exist is rarely put into practice. So we have a lot of work ahead of us. On top of that, it's also important to note that the psychosocial impact isn't just on the individual with diabetes, but it affects the whole family. And people who struggle with mental health often have worse diabetes outcomes and earlier death, outcomes that are compounded by low socioeconomic status. So this is where JDRF is starting to make change. So in late 2021, JDRF Canada launched its mental health strategy as part of JDRF's Improving Lives strategy. So this mental health strategy takes a three-prong approach. First, we'll fund research to develop and test different psychosocial interventions in people with T1D. This research will help build and provide some of this much needed evidence about different interventions to enable improved mental health outcomes among Canadians who live with type 1 that can then be integrated into models of care. The second area is training for mental health care providers, as well as providing postdoctoral fellowships for clinical psychologists in training so that they can specialize in diabetes, which will help to increase clinical and research capacity in this area. The final area of focus for the strategy will be community education and engagement. This is both for healthcare providers, so your frontline providers, nurses, your endos, your diabetes educators, as well as the type 1 diabetes community. The Mental Health and Diabetes Training Program is a collaboration with Diabetes Canada and was a major focus of development in 2022 for JDRF. We officially launched this program in March and have had a really great response so far. So much so that we were oversubscribed and had to add additional training sessions into what we had planned for this year. This program is part of that prong in the strategy targeting the knowledge gap that exists among mental health providers in Canada. Few providers have the knowledge and skills that they need to best support their patients who live with diabetes. So to help fill this gap, JDRF, in collaboration with Diabetes Canada and the support of different partners, subject matter experts, as well as people who live with diabetes, have developed this new virtual bilingual training program. We do have two separate streams. One is for mental health providers, as well as, and then a second one for other healthcare professionals and people who live with diabetes and their caregivers. The program is approximately 6 hours of self-paced e-learning modules, plus a 3-hour live interactive session for mental health providers only. So far, we've had over 260 mental health providers register for the program, and about 70 of those are French speaking. We've had over 550 health professionals and community members register as well. And we had 58 mental health providers actually complete the program during our soft launch phase, which was in last October. And we have our first French cohort coming up at the end of the month, and then 2 more English cohorts this summer. So lots planned to help train mental health providers in this area. We have some space left in French, but English is actually full, and we'll have more in September for English coming up. And just to give you some idea of what the training program looks like, if you want to take it or you know someone, I'm going to just give you a sort of very brief walkthrough of what it looks like. So here is sort of the user dashboard. On the side, we have all the different modules. The program itself is a mix of audio narration, click to interact content, videos of lived experience of from people who live with diabetes, as well as some knowledge checks, quiz type interactivity. So I'm just gonna give you a little sample here.
There's a lot of school transitions. Maybe they're off to kindergarten or grade 1, and they're going to school for the first time in a public setting. And so they have to have a lot of communication with the teacher and the school staff to
So this is just a little piece, and the audio you'll see as you go through connects with a sort of a click to interact. So, Jessica Kitchler is a clinical psychologist located in Ontario, and she was walking us through different transitions that someone might experience, one of which was school. And then as you would sort of scroll through this module, I have a scroll wheel on my mouse pad. You can also use this little scroll bar on the side, and you can just sort of click to interact with all the content as you go through. And then, there's different images talking about, frailty is a later transition in life. We have some information on transition and social determinants of health. And I'm just going to scroll through some of this content, but you can see it's very visual. And I'm just going to play a quick video from Sarah, who reached out and has submitted a video to be part of this training program.
I was diagnosed with diabetes in December of 1994 when I was 5 years old. When I look back on my childhood and growing up with diabetes, the most resounding memory I have is that of loneliness. I felt that my family and my friends couldn't fully comprehend the burden of living with a chronic illness day to day. And I also felt that if I expressed how truly unhappy I was with my disease, that it would be seen as a weakness. So I decided to just keep those feelings inside and not deal with them, which of course just resulted in feeling more isolated and more by myself.
So I'm sure a lot of you might resonate with Sarah's story, and the purpose of having these videos is to, have mental health providers really understand what that lived experience is like. And we've heard the positive feedback around the videos is one of the top comments that come in when we survey people about what they enjoyed, and these videos are some of them. Another thing when you scroll down is you have an opportunity to sort of answer a question, see how you did, and then find out I got it wrong, and you can show the answer and it'll sort of give you the right one. So that's the training program, just like a really short snippet of the larger scope of what that 6 hours is like. So like I did mention, the feedback for the training program has been overwhelmingly positive. This was a quote from someone that was collected during this post survey after the e-learning. We're also surveying participants after the live session for mental health providers to really understand how people are experiencing and what their feedback is like. When asked, how likely are you to recommend this program to a colleague or peer? Mental health providers are rating this program 4.85 out of 5 on average. So we're really pleased with the feedback that we've received so far. The other project that we've been working to develop that's linked to the training program is the Mental Health and Diabetes Directory, which is an online, publicly available, bilingual directory of mental health providers, which is also in collaboration with Diabetes Canada. This will act as a connection tool designed to enable people from across the country who live with diabetes, as well as their care team, to easily identify and refer themselves or their patients to qualified mental health care providers. Providers must successfully complete the training program to be eligible if they want to apply to be listed in the directory. And the directory will be launched later this year, likely late summer, early fall. We're just hoping to build up a greater base of providers before we put it out to the public. Additionally, we're also funding a research impact grant related to the directory and the training program, which will really help us measure and determine if the processes that we have in place are working well, and if the training program and directory are doing what they're supposed to do. So this will evaluate the process and impact, collecting data at both the provider level and the patient level, but the data won't be linked, so it'll be completely anonymous. And so moving on to community engagement, we recognized very early on that since we were starting at the very beginning of tackling this enormous gap in care for type 1 diabetes and mental health, the possibilities of what we could do were endless. We needed a way to narrow down our focus and hear directly from the community about what they wanted, so we weren't generating resources that wouldn't be used. So we put out a volunteer posting to be part of the Mental Health Advisory Council, and it had the largest response to a volunteer posting in JDRF history. This really demonstrated both the need for the strategy as well as the drive from the community to help shape it. The Mental Health Advisory Council is made up about 65% of people living with T1D, and 35% are parents of a child with T1D. The council has over 100 people from across Canada. And so far, we've had them provide feedback and ideas through online surveys. They also recently helped supported the review of our website content on mental health ahead of the refresh, which just went live today. We had a virtual meeting with this group at the end of March, and we do have plans to run focus groups over the summer to really tease out some more ideas about the types of needs and wants of the type 1 diabetes community from this group. If you are interested in joining the council, it is an open call. We're not limiting it because a lot of the data is collected through surveys. You can email me at mentalhealthstrategy@jdrf.ca to express interest, and we're happy to have new members. Now, I'm really excited to announce the JDRF Canada Mental Health and T1D Community Grants Program. So one of the primary objectives of JDRF Canada's mental health strategy is to drive the development of new community-facing programs that will support and improve mental health and wellness in the type 1 diabetes community. So the JDRF Canada Mental Health and T1D Community Grants Program will be launching May 31st. So this is an incubator initiative that will provide seed funding to organizations ready to transform innovative ideas into successful projects that are designed to support the mental health and wellness of people living with T1D and their families. This fund will be available Canada-wide and is an opportunity for local and community-based nonprofit organizations to apply for up to $20,000 in grant funding for their project. Project will be able to take on many different forms, depending on what we get in. We've provided some ideas here. It could be activity-based or creative programming, peer support, the development and creation of new mental health resources targeted towards people who live with type 1 diabetes or their families. And this can take place in person, online, or via hybrid. We're really excited to see what ideas come forward, and you can check out our information for researchers page to find more information that contains the announcement for this program. And looking forward into 2023, so this year we will continue to fund research projects in partnership with Brain Canada and activate 4 new major mental health grants in partnership with CIHR, which Lara will provide more details on in just a moment. We'll also focus on building awareness of the mental health and diabetes training program to continue to increase capacity in the health system of mental health providers to support the patients living with diabetes. Later this year, we'll also launch and promote the Mental Health and Diabetes Directory, both among the diabetes community and healthcare providers. And we know that it's really important to deepen our engagement with healthcare providers on the topic of type 1 diabetes and mental health. So this increasingly becomes more part of everyday diabetes care. We already have a new section of our website for healthcare providers on mental health called Information for Healthcare Providers. And we've just added 2 new downloadable resources on mental health and type 1 diabetes. The 2 topics are on diabetes distress, and the second one is on resilience. And we are planning to upload 3 more resources like this throughout 2023 on different topics. We've also updated our mental health webpage, like I said, incorporating feedback from the Mental Health Advisory Council. Part of this feedback was to include more of the T1D voice throughout the page. And if you visit that page, you'll see there's different quotes from people who live with type 1 diabetes, as well as parents of children and their experiences of how type 1 impacts their mental health. We've also created a new page full of free mental health resources. This is not diabetes specific. We do have a section related to diabetes programs and ways to connect with others on a peer level. And then we have separate resources that are not diabetes specific, available broken down by province and nationally. These are available online if you access the mental health section of jdrf.ca. And another big focus in 2023 is to plan and begin to build new sources of support for the community. As I've just mentioned, this will include the community grants program. We also want to create some new digital resources on the mental health topics. We've already had some blog posts go up on the mental health strategy, as well as some information on our new grants that we just announced. And we're also planning on using the information gathered in focus groups to help shape these new resources for the community. And finally, having events like this one is really critical to keep the conversation going, to continue to shine a light on the importance of mental health and type 1 diabetes. Thank you so much for your time, and I will now pass it to Lara.
Thanks, Amanda. So what I'm going to be presenting here are the 7 research grants that we have ongoing right now. So JDRF is funding 7 different grants that are looking at across the spectrum of mental health programming. And our hope is that these research grants will demonstrate their impact and that we can help push them into clinical practice. So the first grant I'd like to talk to you about is in partnership with Brain Canada. And this is Dr. Mary-Eve Robinson at CHIO in Ottawa, who's looking at mindful self-compassion program to improve diabetes distress in youth aged 12 to 17 years who have T1D. And Dr. Robinson is actually a pediatric endocrinologist, so she recognized firsthand the level of diabetes distress that she was seeing on a regular basis with her patients, and wanted to change that through this research program. It's like I said, it's a mindful self-compassion program. So taking away judgment and replacing it with self-kindness, taking away obsessive overthinking, replacing that with mindfulness, and taking away the feeling of isolation and replacing that with a common experience. It was an 8-week instructor-led course with peer interaction, and I would love to say that it's still open, but it filled up so incredibly fast, which just demonstrates the need for this program. So we're actually looking forward to seeing the results of this program very soon, and we hope to see future work from Dr. Robinson. Another one of the Brain Canada JDRF partnership grants is called Reach Out. This is Dr. Tricia Tang at UBC, and Dr. Tang has a big part in the mental health training program as well. So anybody who's done the training program will recognize her name. So Reach Out is a virtual care platform, and it's focusing on peer-led mental health support. So they've recruited peer mentors who are adults with T1D who are living healthy lifestyles and who feel stable in their diabetes conditions, and they have trained them to be peer supporters. So you're getting this mental health peer support from somebody who's also living with T1D. So it's kind of a dual impact that you get that peer support from someone with T1D and you get some mental health support. So they have just gone through a number of rounds of training their peer supporters, and they are ready to begin accepting people into this virtual program. At the moment, it is limited to British Columbia, but there is hopes to expand it beyond that. And one thing that they are looking at is to target people who are in rural and remote communities who have the least amount of access to these services. And then lastly, for the JDRF Brain Canada partnership, we have Dr. Peter Selby at CAMH, so the Center for Addiction and Mental Health. This was a really exciting grant for us to fund because Dr. Selby is actually not really from the type 1 diabetes world. He is from mental health and addictions, but he is bringing his expertise into the T1D field, and so we'd love to see that. And what he's going to do is he is going to use his expertise in designing mental health technology-based interventions, and he is going to combine that with a participant advisory committee of people with T1D and put those expertise together to create an intervention for young adults. And this will again be looking at targeting improving diabetes distress in young adults. So they are currently in that design phase where the research team is partnering with a participant advisory council, and we're really excited to see what they come up with, and we will keep you posted. And then, as Amanda mentioned, we actually just announced, I think 2 weeks ago, our new psychosocial grants in partnership with the Canadian Institute for Health Research. So that is our federal health funder. So we are partnering with them for 4 new grants. The first one is Dr. Sonia Butalia at the University of Calgary. She is, again, she's actually an adult endocrinologist. And what she found in her practice was that there was a real struggle for youth that were transitioning from pediatric to adult care. So not only were they struggling, but they weren't showing up. And so she realized that this transition point needed some assistance. So they started with a pilot project, and they found that it increased clinic attendance 4-fold. So that's a huge jump in the outcome there. And really what they want to do is they want to support these teens who are moving through this care transition with texting, emails, phone calls, social media, all via non-medical coordinators, just to help them navigate this transition when there's also a lot of other transitions happening in their life, as they finish high school, move to university, change living situations, et cetera. So the pilot program was in Alberta, and to start with, the program, this grant will be taking place at 5 major sites in Alberta, but they will also be developing a toolkit that can be used across Canada. And then our next grant in this partnership is Dr. Deborah DaCosta at McGill University. So again, really exciting that we are bringing Dr. DaCosta comes from the world of prenatal, postpartum mental health, and we are bringing her into the field of type 1 diabetes. So that's always great to see. So Dr. DaCosta has a platform called Healthy Moms, and it provides preconception, prenatal, postpartum mental health support. And in partnership with a group of people with type 1 diabetes and type 2 diabetes, so pre-gestational diabetes that they've already had, existing T1D and T2D, they will be adapting this platform for women and birthing persons with diabetes. And they're looking at the impact of this intervention on mental health, because I'm sure you can imagine that there are a lot of additional sources of anxiety around this time in a woman's life. Our next project is Dr. John McGavick at the University of Manitoba, and this is called the TEAM Trial. So this is focusing on adolescents and looking at how to empower adolescents to live healthy, active lifestyles through a physical activity program. So again, they're going to be using mentors who are young adults that are living healthy, active lifestyles who have T1D. And so they get that connection of the mentorship. They get the connection of other peers with T1D being in the program. And it helps them navigate barriers to activity. So how can they exercise while maintaining their diabetes control and management? So tackling fear and increased risk of hypoglycemia, finding the right type of exercise to maintain that control, and also then tackling the fact that they probably have limited motivation due to poor mental health, which is a very vicious cycle. So we are excited to see this project come to fruition, and what's expected is it will be 1 site in Ontario and 1 site in Manitoba to start with. So we're kind of working across the country here, which is great. Lastly, we have Dr. Holly Witteman at Université Laval, and she is developing a program called Community T1D. This will be a very large virtual peer support network. It's actually a very unique program. So the research team is going to set up this community, and then they are going to take a step back and let the community grow itself and adapt as needed. The hope is that it will foster relatedness and provide both emotional support and informational support through small group meetings. They want to do small groups based on the interests, the hobbies, the life stages of the community. So if you're a mom with a child with T1D who's about to start kindergarten and you're French speaking, there's a group for you. If you're a teen who, is really interested in school sports, there's a group for you. A marathoner who needs tips on how to eat throughout their ultra marathon, et cetera, there's a group for you. So the idea is to keep it really small groups, get that really tight connection, and just let the community evolve as needed. And the research team will be assessing the effect of the community, but like I said, really letting it grow organically within it. So that's something to stay tuned for. We hope that there will be something for everyone in that project. We're really, really excited for it, and we'll keep you posted when it's active. So like I said, all of these grants just announced within the past 2 weeks. So bear with them as they, get their ducks in a row and move through the process of setting everything up. And we will be sure to be posting on our website when people can be accessing these programs. And we're always happy to receive emails. If somebody knows that they're going to be interested, we're happy to take those emails, pass them on to the research team. They're always looking for participants. All right, I think we are opening up to questions now. There's Ruth.
There were just a few that I think I hadn't answered, or one in particular, but just before we get to that, I just want to acknowledge in the chat some chat about wishing that this had been available when you were young, to have had it for your journey. And I just want to acknowledge that that's been heard by us. We understand it's been a long time coming. It is a large gap. That's why we're so passionate about it at JDRF. And the Learn program does have a general stream. And if you do feel it would be beneficial to take it yourself or healthcare provider, it is available and it is free. So the link was in there and it'll be in the email that we send out tomorrow as well. But I just wanted to acknowledge those comments and make sure you knew that we recognize them and we appreciate that it's been a challenge for everyone here that lives with T1D. So there was one question, Amanda, that I didn't want to answer. I think I know, but I would prefer you to answer just in case. Kristen is an RD and a CDE with 25 years lived experience who's completed the training. Does she qualify for the directory?
No, so unfortunately, the directory is limited to mental health providers only. And also, even then, not all mental health providers. So we have social workers, psychologists, psychiatrists, psychotherapists, clinical counselors, and we recently added mental health nurses. The reason is because we want people specifically use the directory to access to find mental health care. It's not going to be for someone to find like a registered dietitian or an endocrinologist. It's specifically limited to registered Canadian mental health care providers only. Thank you for taking the program. Hope you enjoyed it. And it is valid for points through the program for continuing education for CDEs.
There was one question. Oh, someone answered the decamps are run by Diabetes Canada, who is who we collaborate with on this, but that's something that would have to be discussed with them directly, as we don't have anything to do with those camps. Taz asked, what courses are available for parents of T1Ds for us to learn how to help our kids with T1D? Well, you can take this course. And then, Amanda, was there anything else you wanted to add to that?
Yeah, so right now, the course is available. So the target is mental health care providers, but there is a lot of really great information that might be useful to you as a parent or someone living with type 1 diabetes about just how to manage your own mental health. We do have sort of like a caregiver's resource on our radar as something that we want to develop. And we have lots of other ideas. It's really about how do we focus on and how do we choose, because there's so much that we could do. So right now we're really trying to narrow down our focus. We're also a very small team with limited capacity. So we're just really working to see what we can do in a limited amount of time, and what does the community really need, which is why we're hoping to run these focus groups and see sort of what comes out of those, and that will help frame what we do in the future.
Amanda, we had some questions about joining the council. Can the people expressing interest in that also be part of the focus groups?
Yeah. So the focus groups are going to be drawn from the council. So if you're interested in being part of the focus groups, please do join the council, because that's where we're going to be taking the sample from. It's not going to be a wide call to everyone. It will be people who've expressed specific interest in the mental health strategy. So please do send me an email, and I'll connect you to how to become a volunteer.
Hey, Tammy, I'm just putting the answer for the URL. It'll be sent out tomorrow in an email as well, but I'll also drop it in here too.
Yeah, it's a nice, easy one. learn.jdrf.ca.
And do we have any other questions? You can also, at this point, unmute yourself or raise your hand if you prefer to ask the question directly and not have me read it for you. Free to do that too. If you have any comments you wanted to add or share with the group, please feel free as well. Okay. Warren, did you want to unmute yourself or post in the chat? His hand is up. Good. Warren, were you trying to ask a question? Or perhaps.
Hi. I'm just gonna quickly say, actually, first, can you hear me okay?
Yeah, we can.
Okay, awesome. I'm in school for social work right now, and one of my goals was to, or is to, create a virtual telehealth kind of program for remote and rural communities, exactly for what Trisha Tang, I think it was, who I also know from previous conferences, is working on, which is so exciting because if something is already being established, I can just jump on that bandwagon. I'm going to get in touch with her and see how I might collaborate with her in the future, because I live in Alberta, and if she's focusing in on BC and looking for people in Alberta potentially to be a part of the project, that would be excellent. So I'm just so happy to see that project happening.
Really, really happy to hear that. And like I said, Dr. Tang is starting with BC because, you know, everybody needs a starting place. And BC does have obviously a lot of rural and remote areas. But we're also happy to connect you with her because there is plans to expand across Canada. So if ever we can facilitate that connection, please just reach out to us.
For sure. Thank you so much. Will do. That would be wonderful.
This is Warren. Can you hear me?
Yeah, we can hear you now.
Okay, sorry about that. I just wanted to say thank you for actually doing something. This has been a very long time coming, especially in the mental health. I have suffered for so many years, and not being able to reach out and have the resources. Like, I've seen too many people struggle, and as I said, it's just been such a long time coming. I'm very thankful for everybody that is trying to reach out and doing something, because I'm from Kitchener-Waterloo, and just in our area, we are falling so far behind. Never mind the smaller communities. I've been working with JDRF in London, Kitchener-Waterloo for over the last 15, 20 years, doing walks and that. But this is a big, major hand up that JDRF has taken on. And I'm really, really happy that it's going forward to help people like myself that have been suffering and just haven't had a chance to replace, and to even see our young people get the help they need. It's just been a long time coming that we needed this. So thank you for everybody, what they're doing. I know myself, I just want to help out because I don't want to see people suffering anymore and go down this road of not knowing where to get the help when they need it before it's too late, because it's happened to me too much. And I'm sitting here today just trying to get the resources. So anyway, thank you for letting me share.
No, thank you. I'm a bit emotional now. That was nice. Thank you, Warren. Appreciate you sharing. I'm glad that you joined us tonight, so thank you. Kristen had just asked about the program expanding into diabetes, distress, and eating disorders, but I believe that the modules do address that separately. Is that correct, Amanda?
So we do have quite a bit of information on diabetes distress, as well as how to use the diabetes distress for type 1 diabetes scale. The section on eating disorders is quite limited, although we do have some information on our mental health page. We do have a small section on eating disorders as well, which was recently launched today. So if you want to check out the website, we do have some information there. But because there's so much information, it covers most things quite generally, with a few specific things sort of in detail, like, transitions, and so forth. So just what the modules are is we have a diabetes basics, so that's just like learning about diabetes. We have diagnosis and adjustment, and then we have diabetes management, transitions, and then we have a module on complications, successes, and there's another one. And then the sixth one is role of the mental health provider. So these are all just off the top of my head. But yeah, so that's sort of the 6 main modules that are covered in the training program.
Do you have any other questions before?
Hi, this is Kristen. I hope you can hear me okay. I'm on a weird setup here, but thank you for answering my questions. I was asking those questions only because as a healthcare provider who works a lot with people that have T1D, whether they're kids, teens, adults, much like Warren, people have been looking for support for many, many years and just haven't had the resources available. It's great that you're building this directory of mental health providers and you're offering this training program. My question about the deep dive is, I find that people will be referred out to mental health care providers in good faith, but the mental health care providers don't have enough background or experience with type 1 specifically to be able to really provide valuable, effective support. So when you have a young girl who is type 1 and not taking her insulin because she doesn't want to gain weight, yes, it's addressed in the modules that are available now. I'm just curious if there's going to be any further development of any future modules that would take a deeper dive so that healthcare providers who are going to join the directory, who are going to make themselves available, will have a true, useful, applicable understanding, if that makes sense.
Yeah, I think that's a really great question. And very likely. We don't know the timing on it. So the training program just launched. So we tried to keep it to 6 hours so it was digestible, that people wouldn't see it and say, oh my gosh, this is way too long, I'm not taking that. So we wanted to make sure that it was something that seemed relatively easy, sort of short time commitment to take. So we cut out a lot when we first started, when we were going through the process of deciding what we basically said, what is nice to have and what is need to have. And when we got down to it, we had to stick with what is need to have as our base for what was in the content. And I think, moving forward, we know that with the pace and all the research that we're funding right now, we know that we're going to need to do a program refresh, likely already in 2024 or 2025. So at that time, we might look at, do we want to introduce something else, or do we just update existing content to reflect the most up-to-date data and information that we have around diabetes and mental health? And then just to your question in the chat about diabetes distress, I do also want to direct you and anyone else who's interested. So on our information for healthcare providers, we have information on diabetes distress as part of that electronic downloadable resource as well. So shorter answer is likely, but we don't know the timing on that because we just launched, and but we think because there's so much more information that we could expand on, there's definitely an opportunity to have like a part 2, or do we maybe build it out as webinars? We're not quite sure what it looks like. It might not necessarily be e-learning, but it could be some sort of other format of learning and sort of sharing that information.
I'm going to jump in from the research side, just to note that while the 7 grants we presented, none of them focused on eating disorders. Those were open calls, and unfortunately, we didn't get anybody applying with a project that focused on eating disorders, but we recognize that need, and that is something that as a research team, we may go seek out. So we typically open up the calls and let the research come to us. And in rare instances where we recognize that there's a gap we need to fill, we go seek out some research projects. So we will definitely keep in mind how important that is. And this call has definitely reiterated that importance. And yeah, stay tuned, and we hope that we can fulfill that gap.
So just from the chat, Nicole, did that answer your question? She had a similar question about eating disorders as a focus in future developments, which does seem like we are heading in that direction. Sarah was asking about substance abuse and diabetes, and is that something that's has future plans to be covered off as part of the training program, Amanda?
So like eating disorders, it is covered at a high level in the training program. There is some information on substance use and misuse. But yeah, it's something, this is the challenge. There's so many things we could do. And this is why we recommend, if there's something that you want to see, the Mental Health Advisory Council is your opportunity to share, this is something that we need to push forward, and this is something that, is really important to me. And then sort of based on that feedback, that's going to help sort of push off the direction that we go in. And then we do ask, after someone completes the program, did you feel like anything was missing? So we're also keeping a careful eye on the evaluations that come in, and to look to see if we have sort of recurring feedback of something that's missing to include in the refresh. Right now, the biggest piece of feedback that we're getting is people want something like the program, but like downloadable, which is not something we have at the moment, or something they can easily access. When you do complete the program, you can go in at any time and go through it and check it. But I think, for mental health care providers or healthcare providers, they want something they can sort of have on hand, that's printed, that's physical. So that's something we're also exploring, because like I said, we're looking at that feedback and thinking, how can we meet that need that's been expressed? So we're collecting feedback as well, and depending on what the survey evaluations say, we're going to help frame where our future direction is from there as well.
I think that was everything in the chat. So we don't have any more questions. I'll wrap it up, but I just really wanted to thank Laura and Amanda for presenting tonight. And Damien, just to answer that quickly, we will have in the email that gets sent out, the mental health strategy at jdrf.ca email will be included as well. This is a heavy topic, And I appreciate everybody sharing their evening with us and sharing their stories and their questions. It will help inform what we do going forward. And so we definitely appreciate you being with us tonight and providing your feedback. And it seems like a lot of you want to join the Mental Health Advisory Council, so that's great too. And just wanted to say thank you to everybody for being there. We had one quick question about specific programs to help kids with T1D. Amanda, if you wanted to answer that quickly.
Sure. At the moment, no. Kids are, I'll say they're tricky because in terms of mental health and sort of being able to consent to different types of care with or without parental consent. So as of right now, we don't have anything planned for kids. Youth is more something that's like on our radar for priority for mental health rather than kids, just because it's a more challenging time. There's a lot of transitions, as Laura was saying. A lot of the research is going to be focusing on sort of youth and young adults. But at the moment, no, we don't have anything specific for kids for mental health and T1D.
I think I will wrap this up a few minutes before 9 and thank everybody again for coming. Please send any emails that you might have to us tomorrow. We will send out a copy of the recording as well. And hope that some of you will join us next month when we talk about staying healthy over the summer, which is a little bit more of a fun program that we'll be offering. So hope we'll see some of you there and wish you all a very good night.
Thanks, everyone.
Thank you very much.